Welcome to the Wayne and Diana Hutchins Center for Nursing Education on the Springfield campus of Southwest Baptist University. This building was designed with significant input from our nursing instructors, allowing for a seamless transition for our students from the practice environment into real-world healthcare. The administrative office suite contains the Springfield campus director, all of the first semester nursing instructors, and the admission team. The state-of-the-art classroom allows instructors to provide solid, hands-on instruction and interface with our other campuses through embedded technology. Because our students spend long days here, we provide day lockers for the students to use. There are restrooms, vending machines, microwaves, and refrigerators for students who bring their lunch. The Learning Resource Center has many areas for students to practice skill-based instruction, including 14 different patient care or hospital room-style options. These rooms were modeled on Mercy Hospital, so the equipment matches what the students use during their in-person clinical experiences. At the nurses' station, instructors can see into the instruction area through these windows so they can observe the students. On the student side of the nurses' station, students practice electronic record keeping. 8 of these private rooms are available for practice. These rooms have the same type of equipment they would see in a patient room at the hospital. We also have access to Mercy Hospital's record system, which is called Epic. These students can enter patient information in Epic's practice environment, completing their charting on their patients while learning. These rooms provide a great learning opportunity. The Learning Resource Center always has instructors available and is open till 4:30 every day, so students can set up times to practice their nursing skills in a safe and supportive environment. 2 rooms are set up for clinical assessment. These rooms are set up like a doctor's office, so students can practice a different type of nursing than hospital bedside care. Additional features of the Learning Resource Center include mobile workstations for computer charting, as well as a medication and supply room. 4 private rooms have some additional technology built into them to allow students and instructors to work together. You can see up in the ceiling there's a microphone and a camera embedded in each room that allows students to pass their skill assessments, as well as the instructors can actually observe these rooms from the nurses' station. On the east side of this building is our Simulation Center. The Simulation Center provides an opportunity for our nursing students to do a simulated healthcare situation with 7 rooms that allow for a wide variety of skills. All of the mannequins here in the Simulation Center are electronic, so they all have heartbeats, pulse, respiration, and the instructors can speak for them, creating situations that might be happening in a healthcare environment. In the Labor and Delivery Suite, students can practice what happens during a normal labor and delivery, as well as complications that can arise during delivery. Here we have all the simulation equipment that allows our students to practice things that they wouldn't normally get to see or be part of at the hospital, like blood transfusions and code blues. We can also practice complications with our students and what to do if they make a mistake that causes harm to the patient or if the patient has a medical crisis. During a simulation, the student will be a practice nurse, and the rest of the clinical group will be in this room watching the simulation on this large monitor. Every 20 to 30 minutes, the students switch. The simulation can last 2 to 2.5 hours, providing a long experience for nursing students to practice an event from start to finish. This wraps up our tour of the Hutchins Center for Nursing Education, a state-of-the-art facility for students to practice in a great environment that mirrors what they will encounter at the actual hospital. Visit us in person or apply today to begin your future as a compassionate and competent healthcare provider.